Welcome to Forbidden Talk. I'm Jenny Hammond. FGM, female genital mutilation, cutting, female circumcision. They're all different names for the same thing, removing the partial or total female genitalia for non-medical reasons. Although practiced in some African, Middle Eastern and Asian communities, female circumcision has been illegal in the UK since 1985. However, despite this, the NHS estimates 23,000 girls under the age of 15 in England are believed to be at risk of undergoing circumcision. Joining me now is Afua Dorkanu, the Advocacy Director of the FGM programme in Equality Now's London office. Ms. Dorkanu, thank you so much for joining us today.
It's a pleasure.
Well, maybe you could start by telling me how prevalent is FGM in the world today?
Well, the World Health Organization estimates that between 100 to 140 million women have undergone some form of FGM globally.
Well, why is it practiced?
Different rationalization or reasons are given for it, but the main underlying reason is to suppress the sexuality of the girl child. But there are various reasons different communities give for it. You know, for example, FGM is practiced by all people from different religions, Christian, Muslim, non-believers, but in Muslim countries where it's practiced, it's sort of promoted on the basis that it's a religious obligation. But we know that it's not in the Quran, for example, and the Prophet Muhammad, peace be unto him, he never practiced this on the female members of his family.
Well, why is it harmful?
There is a whole range of health complications, physical and psychological risk associated with it. And it's very documented in the medical literature. Of course, I would like to emphasize that there's a range of FGM, you know, from just removing the clitoris to taking everything off and stitching the woman up. The physical complications could include, at the time of the genital mutilation, it could include extreme trauma, pain to the child, because often it's done in traditional environment with crude instruments and with women who are not really trained to be very skilled in this.
Well, thank you so much for taking the time to speak with us today.
It's a pleasure.
According to the World Health Organization, about 140 million girls and women around the world have been circumcised. In the UK alone, every month, at least 70 girls and women seek treatment for related health problems. Joining me now is Comfort Moma from London's African Well Women's Clinic at St Thomas's Hospital, the first clinic in Britain to help women who are victims of FGM. Well, Miss Moma, welcome to the studio.
Thank you, Jenny.
So how common is it for a woman who's undergone FGM to experience problems? Is it every woman, or is it sort of maybe 50%?
I tend to say to professionals, especially, not to make assumption that all women who've been through FGM will suffer the physical, psychological, emotional, or the problems, right? Because from the women that I see and the young adult that I see as well, some will argue that yes, they've been through FGM, they don't have any problems. And one can argue that they don't have anything to compare it with, if you like, because of age of FGM in some area is as a teenager. So especially if you're asking, do you have problems when you having sex? They don't have anything to compare it with. Do you understand what I'm trying to say? And also, in terms of if you want to find out if there's sensitivity when they're having sexual intercourse, they don't know because they don't have anything to compare it with. They'll just give you an answer and say yes or no. So I always say, especially to professionals, not to make an assumption that they don't have any problem, or they do. Again, it depends on the type that have been performed.
Okay. Well, during my research, I have read articles with people saying that maybe there's health benefits linked to circumcision. In your time, have you seen any health benefits?
Well, I've been working and campaigning around FGM for over 25 years, 28 years. And I've never, I can argue because I provide support for women and girls, and I can assure you there's no benefit for FGM. And I know people will argue that, well, it's increased sexual intercourse and it's increased sensitivity, but I will strongly argue against that.
Well, just to play devil's advocate, there was some research by Carla Obermeyer in a 1999 review, and she suggested that no health benefits or anything had been suggested because there just isn't enough research into that. So how would you combat that?
Well, I will combat that because I've been working as a campaigner, as a clinician around FGM for over 25, 28 years, and I've seen the complications of FGM, and I know about this research and the review, but to me, it's kind of, I would say, people are trying to downplay the effect and the consequences of FGM, and also so that people won't take it serious. Because if you're now advocating for the benefit, you need to really look at the complications. Like I mentioned earlier, there's a physical, psychological, and mental complications around FGM. I have lots of girls having flashback, having memories. So to me, you can't justify that as you can't have any justification for FGM. I know people will argue and say it's their tradition, it's their culture. Again, to me, you need to really look at the way FGM is being performed. Like I said, I've been to many African countries and I've spoken to circumcisers, I've spoken to the community leaders, the women and the men as well, and I can assure you there's no benefit for FGM.
Okay. But something that perhaps confuses a lot of people is, we're not talking about now the extreme forms of FGM, but such as you said, you know, they just prick the area, you know, compared to male circumcision, which doesn't really cause any furor at all. You know, why is it that female circumcision?
Again, I know there's argument around symbolic type. Some people call it symbolic type of FGM, where they prick the clitoris and squeeze out blood as a sign of purification. Again, one can argue who is performing this symbolic type. Is it anybody within the community? Is it a barber? And what type of instrument are they using? They inflict more pain to the girls. They inflict infection, tetanus, and lots of girls do die from the short-term effect of FGM. So again, I will strongly argue that there is no benefit for FGM, whether it's symbolic type, type 1, 2, or 3, or 4.
Well, when there are so many problems that are obviously associated with his practice, why is it that it will be the grandmother who maybe will perform it, or the mothers themselves? Because surely they've experienced themselves and wouldn't want that of their daughter.
Yeah, I know. I do understand that, because I myself, I can't get my head rounded for the fact that you, as a grandmother, you've been through it, you've had all these complications, the consequences, and the daughter or your own mother's been through it, and now you want to inflict the same pain to your own daughter. From my experience and from the research that I've done in some of these countries, what always come up is nobody understands or nobody helps, especially the villagers, to make the link between complications of FGM and FGM. For example, if a child dies from hemorrhage, which we know, removing the clitoris is very vascular. You remove it, you'll have excessive bleeding. And if a child dies from excessive bleeding, they just shrug it off and say, well, it's meant to be. She's a witch, that's why she dies. Rather than making the link. So what we're trying to do is we're trying to reach out to the community. It's about reaching out to the community. It's about supporting them and helping them to make the links between complications of FGM and FGM. And it's about mobilizing and empowering the whole community. So again, that's another issue there.
Well, thank you so much.
Thank you, Jenny. And thank you for raising this issue.
Well, joining me now on Skype is American academic Lisa Wade, who has a different take on the issue. Lisa, thanks for joining us.
Well, happy to be here.
Well, I read from your papers that in the West, you've intimated that they have cultural superiority when it comes to female circumcision. Can you explain a little bit more about this?
Americans have very little information about female genital cutting as it really occurs in communities where they practice it. And so what they have is this sort of caricature of genital cutting that they use to judge the practice in general.
Okay. Well, you kind of compare it to, in the West, we have sort of forms of plastic surgery and that sort of thing. But isn't the fundamental point here that for most forms of circumcision, they're done on non-consenting children? So there is the difference there.
Well, that's often true that Americans say it's different what we do versus what they do, because many of the genital cutting practices we have for women are practices that women choose. But this falls apart pretty easily, because if you ask your average American, if someone immigrates from Africa and is over the age of 18 and wants to undergo the traditional African practice in a hospital as performed by a doctor, most Americans will still say, no, that shouldn't be allowed. So we don't like the practices even when they're chosen by adults and performed in sanitary, safe conditions. So that logic falls apart pretty quickly.
Well, you actually use the expression genital cutting rather than FGM. What do you think of the term female genital mutilation?
It's very clear that the word mutilation is a Western word that we're imposing onto those communities. They do not see their practices as mutilating, and when we use that word, it offends them. They hear that word and they hear right away, we're being judged, we're being condemned. These communities don't understand us and they're not interested in listening to us. And so it's really, even for someone whose main purpose is the elimination of genital cutting, using the word is counterproductive.
Okay. Well, thank you so much for taking the time to speak with us today.
I'm very happy to do so.
Welcome back to Forbidden Talk on the subject of FGM. Well, to give a more personal perspective is Sagara Osman, who underwent female circumcision age 5 and now campaigns against the practice. And on Skype, Fumbai Sai Nyoko Amudu, a medical anthropologist specialising in maternal health and child development in Sierra Leone, who was circumcised as an adult and argues the cultural value of the practice. Well, Sagara, Fumbai, welcome to the studio.
Thank you.
So, Sagara, maybe I can start with you. Can you tell us about your experience of female circumcision?
My experience is something, and when I was very young, my mom, she was midwife. My grandmom, she was midwife. My mom, she was a nurse. We used to live in a small village, and my father was a businessman. And my mother, in a small village, my grandmother and my mama, they used to go out and help the poor people outside. And sometimes they're coming late at home. And one day, my mom and my grandmom was not at home. My father's mom was home. And then she decided to do us, me and my other sisters, FGM. That time, I was 5 to 6 years. And when my mom came home, she was very angry because she used to always fight to stop FGM. That's why me and my daughter now, we campaign to stop FGM. Okay. And since 2010, I start in London to support the lady who have been cut, who have been FGM, who's suffering with the FGM problems.
Well, why? I mean, was the experience a negative one? Was it painful? How did it make you feel? Can you remember when you were 5 how you felt?
And really, that time I was young, but still I can remember. And it was scary. It's something you don't know when it's going to happen, and you don't know why they do to you. It was really painful, and it makes me really angry up to now why that happened. And also, it was very bad for me, my first child when I was pregnant. And I cannot forget how bad it was. My first child pregnant, I was very close to die.
Oh my gosh.
And that's why I have to fight to stop FGM.
Yeah.
If here in the UK or in Somalia also, we have to fight to stop.
Well, Fumbai, you just heard what Sagal said. She said it was a very bad experience. Can you relate to that at all?
Well, my experience was completely different. First of all, I'm not Somali. I'm Sierra Leonean American. So I was already in the U.S. and I was in college. I was 21 years old when the women in my family approached me and said that, pretty much told us that we were going to go back to Sierra Leone to join Bondo, which is the initiation, women's initiation. And I was actually quite excited because the memories I had from when I was 5 years old, before we left Sierra Leone, was amazing. In Sierra Leone, the women's initiation is celebrated. There are hundreds of women. There's a lot of festivities. There's dancing. There's masquerades. So it was really exciting for me as a young girl watching all of this. And throughout my life, hearing women refer to it in very positive ways and in terms of empowerment. And the status change that goes along with it. So for me, I was really excited at 21. I mean, I was also scared because I had heard rumors that there is some type of cutting that goes on. At the time, the term female genital mutilation, when I was going, this was back in like 1991, it hadn't gelled. You didn't hear about FGM in the media. So I didn't really associate the practice with any kind of stigma. I had to do my own research to find out what's cut and so on. And when I got there, I asked women, and women kind of laughed and dispelled the things that I'd heard. And I felt quite confident that, my aunts, my mothers, my older cousins who had been all seem normal. They seem happy. They seem, well-adjusted. They are women who are very sexually assertive. So I was quite confident that if it didn't have a negative impact on them, then it wouldn't on me. And so I can relate to the pain that Sagal talked about. Certainly as an adult woman, there was more there to cut than a child. So I experienced a lot of pain, and I wrote about that in an article that was published in 2000. But I also, experienced joy and again, with the celebrations and being with the other women and being with them, it's the celebration of being able to overcome pain. You endure it, you overcome it, and that's part of the trials and tests that not just women go through, but men go through as well in boys' initiation.
Well, Sagal, can you see any cultural value in female circumcision, even sort of maybe the more moderate types, because obviously there are different types from the extreme to just the ritual prick. So can you see any cultural benefits in those?
I think people, they understand wrong. Some people, they think, the small village, the people who live in small village, they still think it's a religion, but it's not religion. It's a culture, and it's a bad culture. We have to know it was a culture, and we have to forget. Last year, I went in Somalia, in Somalia, Puntland. I went with my children to visit my uncle and family. And when I went there, one of my uncle's daughters say, Sagal, if you go somewhere, Bosaso's a little bit far from where I was that time in Carlo. She say, I'm going to do your children, your daughters, FGM. I say, what? And my daughter, she starts cry and say, why you want to do to me? It's not a religion. It's not in the Quran. Maybe you understand wrong. Mom explained to her why she say like that. She said, it's very shame for us. Big lady, 16 years now, and she never been FGM. she have to do it. And I feel really pain. I remember when I was young, and it makes me really angry when I hear to my uncle daughter, and I say to her, I need to sit down with you and talk to you, because FGM, this is really worst thing, can never happen to a woman.
Okay. Well, do you think then maybe it should be a case of, like Fumbai, that women should have the right to choose, so it should very much be not done on children, but done on adult women, and such as in other cultures, like in America, you can have plastic surgery in that area. Do you think a woman should be able to choose whether it's done to her?
For me, myself, I will say, first of all, there is no SUNA, there is no type 3 or type 4. FGM is FGM, and it's the worst thing. We have to stop in this world. We have to fight to stop this.
Well, Fumbai, obviously Sagara is arguing that the problems that FGM or female circumcision can cause. Do you think that the major argument, the reason that so many campaigners are against it, is the fact that for the majority it's done on non-consenting children?
There are many places where the practice is done on young girls, but that's certainly not universal. In Sierra Leone, it used to be that it was girls who were in their late adolescence and young adulthood. There are places, ethnic groups in East Africa, where it's performed on young adult women right before marriage, and these women are encouraged to engage in sexual activity and sexual experimentation and so on. So it's not at all, there's the sort of narrative that this is done on non-consenting children, and that's not universally true. But certainly in certain cases, like in Somalia, it is done predominantly or probably exclusively on young girls. To say that that's the reason why campaigners are up in arms against the practice, I'm a little confused about that, because boys are also circumcised. So if it's about children and children being able to consent to a surgical procedure, then they should also be up in arms and protesting against male circumcision. Now, I am all for, campaigners exercising their right to abolish this practice. But what I don't want to see is a singling out of African girls and women because of the stigma that goes along with it. So what I see a lot now is not so much victims of the operation itself, but victims of FGM, the stigma of it, and a lot of shame that girls carry because they see themselves portrayed in the media as sexually mutilated, as deficient, as in some way impaired. And I think this is unfortunate, because then they start to think of themselves in very negative ways, and that affects their sexuality.
Well, Sagara, I think there were 2 points there. First of all, the first thing that Fumbai mentioned is obviously there are a lot of campaigns against female circumcision, but why not against male circumcision as well?
I think for us as Islam, man is good for him. It's healthy. We believe that. And there is a many community also believe the same what we believe, like a Jewish community. So for me, I don't ever seen man suffering about that, but I have seen a lot and die many women and suffer a lot of different places women. I know every single day I hear and I see and I feel really pain FGM to stop. More important, more than anything in the world.
Well, Fumbai, I just want to go back to you and ask, you've heard what Sagara said, so what do you hope for the future of female circumcision? How do you think it should go?
Well, first I just wanted to let you know and Sagara that there are a few colleagues, about 14 of us from various disciplines, physicians, feminist scholars, legal scholars, anthropologists, and so on, published a public policy advisory on African female genital surgeries in the Hastings Center report last November. And I think it's a really important document because it's a summary of all the research that has been done on the supposed reproductive health and sexual health effects of various types of female circumcision, and then the impact on sexuality and so on. And what the document states basically is that what we hear in the media has been grossly exaggerated. Now, I understand that Sagara underwent type 3 surgery and fibrillation, but that represents about 10% or less of the population of women who've undergone female circumcision in Africa. I'm talking about Africa, where 90% of it falls into the type 1 category or type 2 category. And there are differences, significant differences in terms of health effects. I'm not saying that that refuting that Sagara has not seen adverse health consequences at the doctor's offices where she works. Certainly she has. Women go there because they have problems, they have complications. Uncircumcised women present at the gynecologist with problems. So that population does not represent the entire population of women who have been infibulated. So again, if you want to promote change, social change, then you really have to arm yourself with the knowledge of the actual medical evidence. There's no point in trying to hammer into women that they're suffering and that they're dying when they're not.
Well, thank you both for joining me today. I'm afraid we haven't got much more time, so thank you both, and it's been really interesting.
Thank you, Jenny.
Thank you so much. Thank you.
Well, that's all the time we've left for today's programme, so now it's your turn to join the discussion. You can send us an email at forbiddentalk@levant.tv or find us on Facebook. Thanks for watching. Bye for now.